As major cultural events are forgotten, workplaces, bars and restaurants close, and prominent politicians around the world go into quarantine, two simple questions about the novel coronavirus pandemic seem to rise above the rest. How long will this last? And how will it end? 1. Effective vaccine. The first scenario is seen as the most probable option, is to eradicate the disease for good. A vaccine should give someone immunity, so they do not become sick if they are exposed. Immunize enough people, about 60% of the population, and the virus cannot cause outbreaks. The problem with this approach is it is, unfortunately, very time-consuming and expensive. It still could be a year or more before such vaccines pass the necessary safety and efficacy tests in clinical trials. Investment costs for inoculation are also estimated to cost as much as $800 million. In some cases, a rushed vaccine that hasn't gone through the usual protocol and phases, that require lengthy testing on animals, before human trials, could end up making people sicker, rather than preventing infections. The first person was given an experimental vaccine, in the US this week after researchers were allowed to skip the usual rules of performing animal tests first. Vaccine research is taking place at unprecedented speed, but there is no guarantee it will be successful, and will require immunization on a global scale. The best guess is, a vaccine could still be 12 to 18 months away, if everything goes smoothly. That is a long time to wait when facing unprecedented social restrictions during peacetime. 2. Herd immunity. The second scenario refers to herd immunity, which the UK first wanted to achieve, and then backtracked after criticism for risking the lives of the elderly and the chronically ill. Herd immunity is achieved when enough people in a population are immunized against the virus, by becoming infected and recovering, to be able to effectively stop that disease from spreading. The threshold for collective immunity is thought to be about 50 to 70%, however, the more contagious the disease, the higher the number of immunized people we need to stop it in its tracks. Hence, quarantine, confinement and isolation measures are important. Once the contagion rates drop to 1 or below, the epidemic more or less comes to an end. The UK initially claimed that herd immunity would slow the spread of the virus, and delay its peak, until the summer months, when the National Health Service would be less overwhelmed. But, of course, the higher risks and fast spread associated with COVID-19 would have led to higher rates of hospitalization, and use of critical care facilities. Especially with no effective vaccine in sight, herd immunity still seems to be a risky gamble. 3. Virus will vanish because of the weather. President Trump has been widely mocked for framing the outbreak, at least early on, as a problem that would disappear when the snow melts. But he wasn't entirely off base, experts have said. Based on the epidemiological evidence currently available, there's reason to believe that with warmer, more humid weather the virus will spread less efficiently, leading to a drop in cases, said Jeffrey Klausner, an adjunct professor of epidemiology at the University of California, Los Angeles, who previously worked for the Centers for Disease Control and Prevention. With a reduction in cases, anxiety and panic will go down, he added. Severe illness will decrease, and we can go back to business as usual. Even the deadly hotspot in, for example, New York, would eventually cool, allowing museums and Broadway productions to reopen for the masses. Unfortunately, that's just one possibility. 4. Viral mutation of the virus. The last scenario is a mutation. All viruses accumulate mutations over time, or undergo changes in their genomes. Scientists are hoping that COVID-19 or SARS-CoV-2, which shares 85% genetic similarity to the SARS virus, will mutate in a potentially beneficial way, similarly to how the SARS virus behaved in the 2002 outbreak when it mutated into something much more severe but with a much lower infection rate for humans, practically spelling its own death. Compared to rhinoviruses, the primary cause of the common cold, Coronavirus have a slower mutation rate because they have a process called proofreading, which causes them to move not quite so rapidly. This process happens during DNA replication, copying, when they check their work with each base they add to their genomes. This gives a better chance of developing a vaccine. For example, if the virus mutates to cause more severe symptoms, it may reduce infection rates as it makes people sick enough to stay in bed. This also brings the possibility of vaccine ineffectiveness and resistance. One thing is for sure, there's still much we still don't know about the new coronavirus, so it's hard to tell just how high a mutation rate it has. Its ancestor SARS had a relatively low mutation rate, but influenza is on the other end of the spectrum and thus reoccurs every year. Experts are nevertheless closely tracking the virus and its behavior to understand how it spreads and whether different strains of it are emerging. Well, this is it. What do you guys think? Which scenario is most likely to happen? Comment down below, your opinion matters to us. Thank you for watching. If you like these kinds of video, don't forget to like, share, and subscribe.